episode of the Green Path Psychotherapy podcast. So today joining me are these other clinicians, lovely clinicians. You get more information on our website. So I'll just do a little short introduction. So I'm Alex, part of Green Path Psychotherapy. And we work with all ages, all populations here, but each person has kind of like, I guess, their area of expertise that I'll just kind of point out. So here we have Jess. Jess is highly experienced, and she has background in child and youth work. And she works primarily with teens at our clinic with a strong focus on DBT as well as EFFT, so working with parents and families as well. And then we have Rebecca. And so she does a lot of trauma work, working primarily with adults with a strong focus on EMDR as well as IFS. And then we have Jen. And Jen also works primarily with adults, but also with couples trained in Gottman method, as well as narrative exposure therapy, CPT. So yeah, let's get right into it. So today what we're going to be doing is we're going to be debunking some myths that people have about psychotherapy, as well as answering some frequently asked questions. And so this is going to be very conversational. People are going to kind of pitch in with using their kind of clinical insights and experiences as well. And we're going to try and keep this going on a monthly basis so you can get all this kind of maybe expertise from all these different clinicians, and we're going to be discussing different topics. Okay, so first question, how do I know if my therapist is the right fit? Which I know there's a lot of factors here.
I think it's almost instantaneous with a lot of people. Like you either connect with your therapist or you don't, right? If you walk out of there and you're like, that's not your therapist.
Mm-hmm. Yeah. It's kind of like that first love feeling, right? Where it's like you either know or you don't. Like, how do you explain it? I think a big piece, though, is like the comfort. If you feel comfortable talking to this person, more so than even their training, obviously, like that's a really important aspect as well. If that person is trained in a modality that can support whatever it is that you're coming to therapy for. But I think even in that initial consultation, which we offer, right? The whole point of that is so people can see if it's the right match. Even in those 20 minutes, you can get a feel if you feel comfortable with a person.
I also think if you feel validated by your therapist, that's such a big part of therapy is like, do I feel like they understand my experience or at least can like put themselves in my shoes to some extent, right? Do they feel like they're getting it? Because if you feel like they don't get it, then what's the point, right? You're sort of struggling against trying to make them understand you instead of just being understood.
Yeah, I agree with you guys. I think that, like any relationship, sometimes you click, sometimes you don't click. I also do think that in terms of being validated and seen, there's also, specialties that certain therapists have. And so, if there's a specific need that you're looking for, making sure that that clinician is working in that area, because there are definitely specialties. And so that can also play a factor in terms of fit. So yeah, I think that's all very important.
Yeah, I think also making sure like their style matches your style. And what I mean by that is I use a lot of humor, talk with my hands a lot. Some clients love that. Other clients don't want someone as animated. They want someone a bit more reserved. That's totally okay.
Mm-hmm. That's so funny you say that. I remember when I used to, one of my previous places that I worked, and there was a client who literally said, they're like, you're just so bubbly. But it wasn't said in like a positive way. It's like, not feeling it. Yeah. Sorry about that. So it's true, the vibe, right? Like even gestures, tone of voice, like all of these things can play a huge role as to whether or not you'll like your therapist, right? And you kind of have to like, you're going to be spending so much time talking with them, right? So you can't be annoyed by these things. Yeah. Okay, what if I don't know what to talk about? So you ever have those like clients that come in, especially maybe the first session, and they're like, what do I do? Where do I go? So what do you guys do in those situations?
Ask questions. Right? It's my job to come up with questions. It's my job to figure out what's happening for you and like really investigate that like fully. And like that might be through an assessment, it might be through a conversation. It depends client to client, what makes the most sense. But like I might even pull out an assessment questionnaire and do like a biopsychosocial and see what's going on. But it's not their job to come in and like be like, this is what I want to talk about. They can, if they have it, great. But if they don't, like we can figure it out. We can figure out what those goals are.
Yeah. Yeah, totally. And I would also sort of add on that sometimes just talking about the fact that we don't know what to talk about can be a place to start. Like, what is it like for you to not know what to talk about? Or, maybe even revisiting some of the goals that you had in therapy. Sometimes therapy doesn't have to look like, okay, we're looking at a problem. It could just be talking about what's going on in your life right now. And maybe that connects to other things later on in the session. But the expectation isn't that there has to be something you're coming in for that day. It could be just conversational and maybe it leads to something later on.
I feel like sometimes those are my favorite sessions when someone's not sure what to talk about. But in general, if I have a client who's not sure where to start, usually we might pick a theme. And, if they're really shy or nervous, which is normal, maybe I'll teach them about that theme, or we'll do a creative activity and like color about that theme. So if someone's coming in for anxiety, for example, maybe I'll teach them about it and their nervous system, and we'll do an activity related to it so they don't have to answer so many questions if that's daunting.
And I think
Yeah.
from what I've heard from other people, like clients who've come in, some of the anxiety they might feel around this is maybe they've had previous experiences. Well, they're go to therapy. And I think it depends on the therapist's approach too, if they're like more direct or not. And so, I've heard of like them just going in and the therapist just kind of like waiting for the client to start, right? And like they won't direct the session. And so for some people that can be really great. It's very like keeping it open for the client to, direct it and kind of use the time in the way that they want to. But not everyone knows like what to do, right? And so in that first session, it can feel so intimidating. You come and it's like, I had the consult with you, you know what I want to work on. So where do we start with this? Right. And so I also take like more of like a direct approach. And so just navigating like here, this is what I typically do in my first session. We're going to go through confidentiality and then we'll, add on to the list of anything else that you want to work on in therapy. And then just start asking questions to get to know that person. If they don't want to answer something, that's totally fine too. Answer whatever you feel comfortable or share whatever you want to share, but it's not a necessity either. We can kind of navigate according to your comfort level.
Yeah. I would also say sometimes if like clients really struggle, I also recommend keeping a journal and writing things down as they come out. Because sometimes, throughout our week, we're busy, we're not thinking about what's going on. And so just pausing and just writing something down or whatever can be helpful for us to keep track and then bring it to therapy the next session.
Mm-hmm.
I have clients who sometimes come in with a full list.
Mm.
They're like, these are the things that happened over the week. This is what I want to talk about. And that's cool. And that's not always where people are at, right? And so you kind of have to meet them where they're at and figure it out.
Totally. Yeah. Yeah. What about for people who are scared that therapy can make things worse? And what I mean by that is like leave them maybe feeling more vulnerable than when they came into session.
That's very possible. Really possible, right? Especially like I give this warning to a lot of my clients. I'm like, we're going to take away some of the coping skills that you've been using because they're maladaptive and replace them with better ones. But in the process, it's going to get worse before it gets better because you're not going to have those skills to rely on anymore. And so like there is a time where you're going to feel vulnerable and you're going to feel open and you're going to feel like an open wound for, a little bit. And like you're going to get through that and you're going to get to the other side of that and it's going to be so worth it. So it's like, could it get worse? Absolutely. Right. And that's why your therapist is there to help you through that.
Yeah. I find that especially with trauma work, that's a big thing, right? It's like when we're opening wounds, of course, allowing people to go where they want to go. It's not like I'm, it's a necessity for you to talk about things that you're not ready to, but it does mean that there's going to be discomfort. And so leaving a session feeling more uncomfortable doesn't necessarily mean that things are worse for you. It's just we're working through that pain in order to get to that other side, which hopefully will give you some of that relief.
I've had some people in trauma training use the metaphor of like you're cleaning out a wound. And so if I were to leave an infected wound, it's not going to get better. But cleaning it would really hurt, but it's important for it to heal. So sometimes that metaphor helps of like, it makes sense, it hurts, but it'll help in the long run.
Oh, that's great. I like that metaphor.
Yeah, and I would say, of course it's challenging going back, but knowing that you're in a supportive space and a therapist is there to guide you. And if things are too much in the session or overwhelming, that's always something that you can negotiate and talk about in session and find ways to cope with it. Also, in the short term, there are ways to help with that as well. Like as you go through it, obviously we want to also match the coping skill to whatever is happening. So there are, sometimes we go a little bit into the pain, and we come back and we cope, and we kind of go back and forth between the two so that it doesn't feel so overwhelming. But yes, there's discomfort for sure in that process.
And I think that could be such a rich opportunity too when a client is feeling really uncomfortable and maybe, there's that part of them, a protective part that's like, I don't want to go back, to actually come back and to be able to trust their therapist enough to share that that's how they were feeling so you can process that together, right? And even go through the ebbs and flows and knowing, hey, okay, we know what your like threshold is here. And so now let's, do this thing and kind of get out of it before we get back into that, right? I think it's really hard when people do feel like super uncomfortable, but then, they don't come back. We've kind of like opened this wound and, now it's kind of like left untreated. And so what's going to happen there? I even oftentimes when people want to do EMDR and they're specifically like requesting that, so more structured trauma treatment, I say it's intense work, right? And so, it's something that does require commitment weekly or bi-weekly. And we are visiting something and revisiting something that's going to be really painful over and over and over again. And so bracing yourself for that, but also knowing that, hey, like I'm here to support you through that. You're not doing it alone, which maybe in the past that has been something that you've been doing. Okay, this is kind of like a bit of like I don't know, like a funny question, a cute question. What's something clients apologize for in sessions that they absolutely don't need to?
Crying.
Yeah,
That's a big one.
totally.
Yeah, clients almost always apologize when they cry. And I'm like, if there's any place to cry, it's therapy.
Subsequently using tissues for crying.
Yeah, we have lots of boxes of tissues for a reason.
Yeah, in many ways, like when clients cry, it's kind of a win because it's like, yes, you're processing, you're releasing, there's research on like how tears, like there's cortisol that gets released through your tears. It's so powerful to cry, and there is such a relief after crying. So if anything, therapists are like, yes, do it, right? Not in a bad way, but in an encouraging way, an excited way for you to release everything. So keep crying.
Another one Jen and I were talking about earlier is swearing or getting frustrated or angry in sessions. It's almost like any emotion gets apologized for because I think we're conditioned to apologize for our emotions outside of therapy, that when we walk into therapy, it's hard not to apologize for like feeling things. And so like I'll make my especially my teenagers really comfortable and be like, you can swear in here, you can say whatever you want. And I'll even sometimes like swear at them just to like make it more like, and they're like, oh, like that shock look of like, oh, you swear too? Okay, all right, this is a safe space to swear.
Yes. Yeah. I've had that moment too where like a client will swear and then I'm like, okay, I'm gonna join you with that. And then I swear and then they look at me and they're like, oh, like, is that supposed to happen? And it's like, yeah, this is okay in the therapeutic setting. We're allowed to push those boundaries a bit. Okay, so what would you say is the difference between coping and healing? I think this is really important because oftentimes I think clients will come to therapy with the hope that they will feel better, like they want to feel better, right? And you know, I heard this a lot, especially during the pandemic. People would come and be like, I just need coping strategies. And I'm like, okay, yes, there's a coping strategy, but what are we coping? Like, what is the issue that we need coping for? And do we actually need to maybe process some of that, right? Before we just do something that maybe will distract us from the pain that we're feeling. So what would you guys say? How do you differentiate between the two?
Yeah, what I would say is coping is short term, healing is long term. And kind of like the analogy given by Jen of like, you know, you have to clean out the wound. Coping is like taking breaths in between the cleaning. So, you know, having those pauses while you're going through it to really deal with what's happening and the pain that's going on. But eventually it gets cleaned out, and those coping skills, you don't need them as much. So, you know, it's more of like an assistance to the healing.
I agree with Rebecca. I think like coping skills will help you with the healing, but they won't heal for you, right? Coping is like getting through, like in DBT especially, we talk about like distress tolerance skills, and how distress tolerance skills are about getting through the moment that sucks without making it worse, right? That's what coping skills are. They help you get through stuff without making it worse, but it doesn't necessarily make it better.
Mm-hmm.
Yeah.
Yeah. And I think sometimes coping, if used incorrectly, can actually become an avoidance strategy. So it has to be balanced properly, right? Breathing through something will not heal the wound. We have to go back into it in order to actually heal. So, you know, as much as coping skills can be helpful, they're not going to fix the issue.
Yeah. I think that's a big thing with CBT. So when we're doing exposures, I'm really mindful of even bringing in coping strategies, because if it is used as something that someone is using to like avoid the discomfort, right? Like we're trying to lean towards the discomfort. You need to feel uncomfortable in order to feel better. And so rather than it becoming like a crutch, it's like, how do I just use those strategies in times where I'm, let's say, so overwhelmed where I need to kind of come down a little bit? I think that's where coping can be really helpful. Welcome back.
Coping can be helpful when your Wi-Fi cuts out.
Jen, you froze for so long. We were all staring at you being like, what is happening? It was actually really funny.
I did want to go back to Jess's metaphor where earlier you said, you know, kind of it might get worse before it gets better. I kind of think of coping as like putting a Band-Aid on a wound. You know, you're making sure to kind of stop the bleeding. It's not getting worse. Whereas healing is more, you allow that wound to fully heal without infection. And you might have a scar after, but you're really allowing that wound to heal up.
This is our last question. What's the biggest myth about therapists themselves? What have you heard, maybe through the media or maybe through your clients, that is just like, wow, that is not an accurate portrayal of me or other therapists at all?
That we somehow got our lives fully together, right?
Mm.
That like that's, I think, the biggest one, right? Is that like they'll think that, you know, we don't have problems, or we haven't, like I'm in therapy too, man. Like it's not a one-way street. It's not like I'm sitting there and I've got all the answers.
Mhm.
It reminds me of like little kids at school. Like when you're a little kid and you think your teacher lived at the school, like therapists also exist outside the office.
It's true. Yeah, it's so true. And we, you know, I think kind of going with that, this idea that like we would know everything about everything, like we as therapists have to continuously be, you know, studying and taking courses and doing things, because it's impossible for us to know absolutely everything about every condition. So, you know, we definitely are, you know, a continuous project ourselves, right? Like everybody.
Mm,
We do love a good cardigan though.
My cardigans have become Athleta panorama wraps now. That's what I wear. But it's same concept.
Yeah, I think the other piece is couches. Like that hasn't gone out of style, right? With the therapist. So feel free to come in, lie on the couch, and we're not doing psychoanalysis, but you can kind of pretend you are.
Yeah, get comfy. You know,
Yeah.
and like we can dim the lights. If the light's too bright, tell us to turn it down. We don't have, make it comfortable for you.
Totally. Yeah. Even just kind of highlighting that piece, it's funny when I've worked with couples in the past too, where I'm like, oh my God, this dynamic feels so familiar. Oh, wait, that's me, right? Like, where even if we're going, like, we are still helping people, even if we're going through a similar issue, right? And so I think it just speaks to, I think it adds experience to, what we're already doing with that client. But yeah, it does not mean at all that we have it all figured out. So it just highlights, I think, that humanity that, that we possess too.
Yeah, I
Well, and
think it,
sometimes I get the exact same comment from my therapist that I give to my clients, right? Like I have the exact same problem. I'm thinking in black and white, or I'm saying shoulds or whatever. And I'm like, oh, she's catching me do what I catch them doing.
So
yeah, I feel like so like, the ability to relate to others is really why empathy works. We can, if we can relate and understand, it's because, we've had that experience. And so it is a strength in many ways for that sense of bonding or validating clients. So, I think it's definitely normal, and it's the part of relating to others that I think makes it so therapeutic.
totally. Yeah, it's like essential for that connection.
Yeah.
Right? Yeah. Thanks so much, everyone, for joining us today. We look forward to our next conversation that'll happen next month. If you have any questions about anything that we talked about here, you want to learn a little bit more about therapy, you can always reach out to us at greenpathpsychotherapy.com. We'd be happy to answer any of your questions. If you have any questions that you want us to answer in a future podcast, we are also open to that as well. But thanks everyone again for joining. Hope you have a good rest of your day.